Thank you for joining us. I'm Naiba Reynoso. Ahead, the impacts of the coronavirus hit one LA County family hard. And later, see how restaurant inspectors are protecting the public. But first, investigators search for clues on what started a fire that ravaged the San Gabriel mission last month. Meanwhile, the process of recovery and rebuilding has begun.
It was just shock, a little bit of shock. A little bit of feeling like somebody punched you in the stomach. And then it was a lot of tears and a lot of people sharing and disbelief, just the disbelief. We just couldn't fathom that this was happening.
And I'm sure the firefighters, when they're fighting this fire, they probably go on a lot of calls, but this one was so much history, 250 years.
Father John shared with me that the first firefighter that he spoke to turned to him and he said, I was married here. And I said to Father, I am grateful. My daughter just got married here in November. My parents were married here, remarried on their 25th, 40th, and 50th anniversary. And my brother is buried here. So many people have so many connections here.
Wow, that gives me chills. That's amazing. The stories. There's no question. I mean, this is my childhood. I grew up in this area, and I remember I have so many fond memories here. But tell me what you've learned about the community since then. I've heard that there have been outpouring
of support, financially, emotionally, people coming and sharing their stories. Still standing.
Yep, and that, I mean, when I heard that the altar was saved, I mean, I thought, that's...
Not amazing?
Yeah.
Stopped right there. Yeah, about 3 years ago, I brought the idea to our then pastor about renovating the campus. We were going to beautify the inside of the church and paint the walls and fix the pews in preparation for our 250th next year. So when I walked out of the church on Friday, I thought, wow, it's beautiful. And then the day of the fire, I said, well, it was beautiful for one day. This is a tough old building, and like our community, we will rebuild and restore and just bring it back to life.
And that's what we're going to do. We're going to rebuild. We're going to work on this together. I stand by you, and I appreciate everything you've done. I know we're going to get it done.
We are, absolutely.
In early March, Christine Brown fell ill with COVID-19 symptoms. She spent 2 weeks in Olive View Medical Center and ended up on a ventilator. Despite the odds, she survived.
In the beginning, I have a COVID-19, but then I started to have a shortness of breath. And that's when I went to ER and it got very serious. I checked in the Harbor UCLA and then they checked my vitals and they immediately put me in the ventilator.
There was a point when I thought everything would be okay until the doctor called me and kept asking, when is she gonna come home? When am I gonna be able to talk to her? It wasn't until then when he told me it's not when, it was if she's gonna make it back home. And that was literally just the worst thing I could ever hear. Knowing that my wife might not ever come home.
I was on a ventilator for 8 days and I have no idea what's going on. I was so scared in the hospital and I have no idea if I'm gonna live or I'm gonna die.
It put me in a dark place. I didn't know what to do. I couldn't even be there for the ones who needed me. When she came home, I knew she had some recovery to do. Sometimes I need to tie her shoes. Sometimes, I need to help her comb her hair. I didn't know how bad it would be. And honestly, she's still recovering. There's no prejudice on this. It's just, it will go after you. There's no immunity. You're not invincible. It could get you.
I'm Christine Brown, I'm 31 years old, and I'm a COVID-19 survivor.
Restaurants in LA County are operating, but because of the pandemic, they can only offer outdoor dining, takeout, and delivery. Take a look at how public health investigators are making sure your dining experience is safe.
Today, I'm here to do an investigation on the restaurant to see if they're in compliance with the health officer order to stem the coronavirus pandemic. We go to restaurants to guide them, to inform them, to check out the measures that they're doing to ensure that the public is safe. Before we even get inside, we check for physical distancing markings and the proper signage on the doors. We have a generated list that we go over with the person in charge to make sure they're in compliance with the health officer order. We ask all these questions to facilities so that we can ensure that they're doing infection control, physical distancing, and also communicating with the public.
Every day our team member is going to come into their shift. We take their temperature right at their forehead, states 97.8, comes in green with a little smiley face.
Our first priority is the safety of our team members and guests. You know, it has been a difficult transition, but here at BJ's, we strive to always say yes to our guests. It is our job to make the guests feel welcome, safe, happy to be here. Through this difficult time, we're just excited to be open.
I think that it's great that public health is coming out, making sure everything's up to par. And yeah, it's uncomfortable with the mask and, you know, the distancing and not the crowds, but honestly, I appreciate it. If it's to help us better the situation, then I'm all for it.
LA County libraries are continuing a popular summertime program that provides meals for families in need. Here's how the county's libraries are making a difference.
So Lunch at the Library program is an opportunity for us to provide free meals to our families here at the library. The program runs Tuesdays through Fridays, 12 p.m. to 1 p.m., and we'll be giving out lunches through August 7th. LA County Library has been offering this program for the past 6 years in partnership with the LA County Department of Parks and Recreation. In previous years, we've had the kids come in and eat. In light of the current situation this year, we've changed our model. So we are now offering a grab-and-go contactless pickup for the parents and the children. This would ensure that we keep social distancing.
I think it's great. It's a really great help at these times that we're facing, so thank you very much.
If you want more information on Lunch at the Library or any other library programs, we encourage you to visit us at our website at lacountylibrary.org.
Thank you very much.
The libraries aren't the only ones helping to put food on tables. Check out how the Los Angeles Regional Food Bank partnered with the Department of Parks and Recreation to provide food for more than 2,000 residents in Lakeview Terrace.
Today we are at All Nations Church at Lakeview Terrace. We are conducting a drive-through food bank distribution event. We're hoping to serve up to 2,000 households today.
We've held more than 100 mobile drive-through types of distributions throughout Los Angeles County to help families and individuals who are struggling, many who are just out of work and with our high unemployment rate are just having a really hard time paying all their bills and meeting all their basic expenses.
My mom is jobless. I stay jobless as well. So it brings a lot of help and it brings the community together as well.
Yearly, we have a number of people who suffer from food insecurity. With the pandemic that recently occurred, that number has increased substantially, and this is one of the methods that the county is using to help people.
So it's obviously been very difficult, and I think this is just a great resource that's obviously gives us one less worry about providing food on the table.
The county has a website, covid19.lacounty.gov, for all your resources during COVID and all of the various food distribution events.
Looking for answers on the coronavirus? We have them here in a new segment called Ask the Doctors of LA County.
Dr. Jasmine Eugenio. I'm currently Associate Medical Director of Los Angeles County's Martin Luther King Jr. Outpatient Center. LA County is reopening, but the threat of COVID-19 is not over. It's a very real threat. So, in order for us to prevent the further spread of the virus, we need to continue to do the necessary precautions, such as washing our hands, using our facial mask, physical distancing, and minimizing travel as much as possible. Everyone has been asked to stay home for a long time now. And we understand you may want to eat out, go and meet your friends, but it's very important to remember the preventative measures we've talked about for a long time, such as physical distancing, wearing your facial mask, washing your hands, and more importantly, keeping a bottle of hand sanitizer available for use all the time. You can get tested for COVID-19, but first, you should call your doctor. If you do not have a doctor, you can call 211 and they can help you find a provider. If you need more information on the testing sites, you can log on to covid19.lacounty.gov. Remember, we only recommend that you get tested if you are experiencing symptoms, if you have underlying health conditions, and you're over the age of 65. All testing is confidential. At no time at all will your information be shared with immigration officers. Everyone can be tested regardless of their immigration status. Rest assured that your information will remain private. Remember that we are here to take care of you and your health, and that includes non-COVID symptoms. If you were able to go to the ER before the pandemic, you can do the same thing today. It is better for you to see your doctor now than to wait for your symptoms to get worse and get medical care.
Got 60 seconds? Meet Hugo Ramirez. He's a respiratory therapist at Olive View Medical Center, providing life-saving breathing treatments for patients in his care.
Hi, my name is Hugo Ramirez. I'm a respiratory therapist here at Olive View Medical Center in Sylmar. We deal with anything from a mild shortness of breath to acute respiratory distress where we have to mechanically ventilate a patient, and anything in between there to help them breathe. Being a frontline worker during this whole COVID crisis has really had to sharpen my skills so much more. It's impacted my day-to-day work by tenfold. We have more patients, more severe cases. Everything that we do now is trying to help these guys breathe, but it's really interesting to see on how much this disease process has just changed our environment, our lifestyle, all the way around. The impact of my work has really been the way I've been able to help these patients and understanding what might be wrong with them and what problems they have. I try to teach them as much as possible from whatever I know to help them out. One of the cool things I enjoy about my job is the fact once I see these people come out of this stress that they're in or any problems like that, I'm able to see them walk out of here. They'll just tell me I changed their day, I changed their world, because one thing that they're able to do now is breathe better.
Thanks for joining us. We'll see you next time on LA County Close Up.